Well, with our economic downturn, a lot of parents are looking for ways to cut financial corners. Unfortunately, one of the areas that has taken a hit is in the oral health care realm. And this means that parents and children alike could be missing out on important annual dental checkups. Dr. Haress Rahim from Bloo Dental has been looking at this trend, and he has some straight talk for all of you parents who are concerned about your kids' dental health. Doctor, thank you very much for coming in today.
It's great to be here.
Good to see you.
Good to be here.
Boy, brushing your teeth is so key, isn't it? Getting the little kids started early.
It is, absolutely.
And I'm always amazed at how many parents neglect that.
Yeah, absolutely. And this is one of the reasons why we recommend that a child's first dental visit be by the age of 1, just to get them into a good habit, to help parents learn how to take good care of their kids' oral health. And what we found out is that when kids come in on a regular basis to the dentist, it really helps them to prevent a lot of other problems or issues that can arise later in life.
What is the single biggest problem you see among kids?
Amongst kids, what I hear from parents is just getting kids to brush and floss on a routine basis. So parents will say, "Oh, did you brush and floss your teeth today?" Well,
right.
you know, so it's just getting the kids into a habit of taking care of their teeth and gums on a regular basis at home.
Now, we saw this absolutely a worst case scenario. It happened in the D.C. area, I think in Prince George's County last year. You may remember the story of a child who had been neglected by his parent to properly brush and take care of his teeth. Ultimately had, I think it was an abscess tooth, right, that was not taken care of, and she didn't make dental appointments for him, or there were no dentists available. I should also make that. And eventually he died from an abscess tooth.
Absolutely. So what happened is that it ended up being a cavity. The cavity ended up getting worse, making the tooth abscess, and it eventually ended up infecting his brain and leading him to die. And things like that, like a small cavity, can be taken care of very easily at the dental office, and not allowing it to progress to such a severe stage. There's
a perception out there that because children are small, because they have baby teeth that will be replaced by adult teeth, it's not important or as important to take care of the baby teeth as the adult ones. Is that true?
Well, baby teeth play an important role. For example, if a child has a toothache, it can affect their learning because they're in pain, they're in discomfort, they're not sleeping well. Also, essentially, baby teeth lead the way to adult teeth. It helps with spacing. So baby teeth definitely play a very important role in the future.
Teaches them as well how to form words?
Oh, absolutely. It helps them with their speech. So if they lose their tooth early, it'll be difficult for them to pronounce certain words. Just like with adults, if they're missing some teeth, speech becomes a difficulty for them.
Let's talk about some of the toothbrushes you have here, and what is the best to use and the most attractive to young kids?
I think one of the best ways to motivate kids to brush and floss at home on a regular basis is to try to make it as fun as possible for them. And some of these products probably didn't exist when we were kids, and going to the dentist wasn't as fun then as it is now. So for example, we've got this spin brush. So one of the things is that it spins hundreds of times per minute, so it makes it a lot better for the kids to brush their teeth. Plus it has a Princess Disney character, and I don't know of too many girls that don't like Disney princess characters.
That's the girl's toothbrush right
there. Absolutely. And we were talking about flossing. Well, just like with adults, it's difficult to reach in those back teeth sometimes. So this helps to hold the floss for the kids.
Hold that up real still there for a second. We'll get a tight shot of it. Yeah, that's perfect right there. Yeah.
So it helps them to floss. It's got fun characters on the floss holder that they can relate to.
It's hard for little ones to wrap the floss around their fingertips. It hurts a little bit.
Yeah, it makes it very difficult for them. And these are what we call stages. So they're almost self-explanatory. They are particular for the kids' age group, and again, characters that they can relate to, and particular to their size as far as being able to grasp it easily and brush.
Now these toothbrushes, you have the rotating tips on them.
Right.
The adult versions of that, like the one you have here, with these do something different. They just vibrate at an extremely rapid speed, right?
Absolutely. And
which is better, the rotating ones or the vibrating ones?
Well, they're both actually very good. For the kids, we recommend something like this. So for kids 3 and above, we recommend this spin brush here.
Okay.
And then this electric brush we recommend for older kids, like 10 years of age, and for adults. Again, they both work very well.
Okay. Yeah. And you've got a variety of tips associated with that one. Which is the best, and which are the different purposes of them?
Well, depending on the situation. So
let's hold those up here for this camera shot. I'll get it. There you go.
So, for example, if a kid is in braces, then they can use this tip, and this helps to go around the bracket, the orthodontic bracket. This helps if an adult or a kid has, again, a bracket or a bridge, and they're trying to get it in to an empty spot.
I see.
And these two can be used by all patients.
Okay.
Right.
All right.
Yep.
Something for everybody.
Absolutely.
I switched to these the electronic about a year ago, and I love it. I mean, it's so much better. It feels so much more thorough than the traditional manual brush.
Because you think about it, in 1 minute, this spin brush or the electric brush moves hundreds and hundreds of times, and with a manual toothbrush, it's just not possible to move your hand that much. And as another way that we can make going to the dentist or dental care fun for kids, in our practice, when kids walk in the reception room, we have video games for them to play. We have a TV dedicated for the kids. And when they're in the dental chair and they're sitting back, they actually have wireless headphones, and they're watching a DVD of their choice. So we tell them on the next visit, you can bring your own DVD. And this has been such a hit that we even have adults saying, well, I'd be happy to come to my next appointment if you'd put a TV up there. So now our adult patients also can watch TV.
Sort of like acupuncture.
Right, yeah.
Distracts you.
Yeah, distraction.
Any drills in the mouth.
Right. And what we found and what our pediatric dentists say is that watching that TV has been a bigger hit than even laughing gas or nitrous. So we just like to make it as fun as possible for the kids and get them involved with the family as far as brushing and flossing on a regular basis at home.
Dr. Haress Rahim, thank you so much for this great advice. Please, parents, do not neglect your kids' dental health.